Welcome back to our channel. Today we're going to be setting the record straight on 10 of the most common myths around breast cancer in terms of screening, prevention, treatment, and more. If you enjoy our videos, don't forget to hit the subscribe button below for more helpful tips and advice on navigating life with cancer. You would think that online information about breast cancer from reputable sources would be valid and easy to decipher, right? Unfortunately, that's not the case at all. Breast cancer facts are often full of misconceptions and even inaccurate medical information, which can result in confusion and fear for most people, and rightly so. Cancer myths are born from a lack of accurately informed people spreading information to others. One major culprit is social media. Anyone can pretend to be professionals on platforms like Instagram or YouTube, and sadly, it's the inaccurate information that tends to get more engagement than factual information. Unfortunately, this problem seems to only be getting worse, both online and in person, meaning coming directly from healthcare professionals. For example, several oncologists are still telling their patients that it doesn't matter what they eat after a cancer diagnosis, or that making healthy changes to their diet won't help them fight cancer. This is so far from the truth that they should actually lose their license to practice medicine, in my opinion. So without further ado, let's get into the top 10 myths around breast cancer. Myth number 1, mammograms will raise your risk of getting breast cancer. First of all, mammograms are the gold standard for diagnosing breast cancer. Because they examine your breast through multiple X-ray images, many women fear that the radiation emitted during a mammogram will raise the risk of getting cancer later on. The truth is that there's not been a higher incidence of breast cancer due to the radiation from mammograms. According to the American Cancer Society, the low dose of radiation that you're exposed to from mammograms is actually lower than the amount that you're exposed to from background radiation, meaning radiation from your natural surroundings, over the course of several weeks. Second of all, the potential life-saving benefits of detecting breast cancer at an early stage from a routine mammogram far outweighs the concern of being exposed to the small amount of radiation from mammograms or other diagnostic imaging tests. Myth number 2, breast implants cause breast cancer. Breast augmentation, either for aesthetics or reconstructive purposes after a mastectomy, is typically done with one of two types of breast implants, silicone gel-filled or saline-filled. Although breast implants do come with possible risks like bleeding, infection, or other risks from surgery, they don't cause breast cancer, nor do they raise your chances of developing breast cancer in the future. Breast implants can, however, make it more difficult to detect breast cancer in a mammogram. So if you do have implants, I would recommend looking for a clinic that's experienced in doing mammograms for women with breast implants. Usually, extra imaging angles and views are necessary to get a clear image. Myth number 3, antiperspirants cause breast cancer. Because antiperspirant is applied near the breast, and some ingredients may have estrogen-like effects, particularly aluminum-based ingredients and parabens, there's been speculation that some deodorants and antiperspirants can increase your risk of getting breast cancer. It's also been thought that since antiperspirants stop you from sweating, your lymph nodes, which are located under your arm and throughout your breast, won't be able to rid your body of toxins. However, it's been proved that this isn't something you should be concerned about, since it's more your kidneys and liver that remove most cancer-causing toxins from the body through urine and bile. Also, there's been plenty scientific studies done on the relationship between antiperspirants and breast cancer. There hasn't been any evidence shown that they do cause breast cancer. However, if you've been following me for a while, you've probably heard me say this before, that the chemicals in our makeup, hair care products, and deodorants do get absorbed into our system and are thought to be one of the main reasons for the increase in cancer incidence. So although the average antiperspirant may not be directly linked to breast cancer, using one that has less chemicals is always best to reduce your cancer risk. Myth number 4, nobody in my family had breast cancer, so I likely won't get it. I hear this from my patients all the time, who tell me they were shocked to hear they had breast cancer because they had no family history of it. But the truth is that the vast majority of breast cancer patients have no genetic risk factors at all. In fact, the latest scientific research is showing that only 5 to 10% of breast cancer cases are caused by a genetic mutation that's passed down through genes. This means that the majority of breast cancers are sporadic and have no link to genetics. So because family history is only one small factor that increases your risks, screening is important for all women. Every woman starting at the age of 40 should have a yearly mammogram, regardless of their family history. And if you do have a family history of breast or ovarian cancer, I would encourage you to speak with a genetics counselor by the age of 30, as you may need to begin breast cancer screening before the age of 40. Myth number 5. If I do regular self-breast exams, I don't need to get a mammogram. Not all types of breast cancers can be detected by a palpable lump. Some are only detectable through imaging procedures like a mammogram or ultrasound. Although you should be doing self-breast exams monthly, you should also be going for yearly mammograms. A good way to remember to do your self-exams is to do it on the first day of each month, or better yet, schedule it into your calendar. Myth number 6, all breast lumps are cancerous. If you find a lump during a routine self-exam, there's no need to panic. Most breast lumps, around 80% of those biopsied, are benign, meaning they're non-cancerous. Many of them are fluid-filled sacs called cysts or scar tissue. However, any changes to your breast should be discussed with your doctor immediately. Other symptoms of breast cancer can include pain, swelling, redness, or thickening of the skin. Myth number 7, there's nothing you can do to decrease your breast cancer risk. This couldn't be further from the truth. There are several things you can do to decrease your risks. Maintain a healthy weight and diet, limit or avoid alcohol and smoking, exercise regularly, perform monthly self-breast exams, avoid taking birth control pills, particularly after the age of 35 or if you smoke, find out your family history and discuss it with your doctor, and avoid hormone replacement therapy for menopause if possible. Myth number 8, a breast injury can cause breast cancer. Although this is not true, an injury to the breast may cause tissue changes that can mimic breast cancer on imaging. It can look like an irregular mass on a mammogram, which appears similar to a tumor or cyst. The best way to distinguish cancer from damaged tissue or fat necrosis is with a needle biopsy. Myth number 9, a healthy diet and lifestyle will eliminate your risk of getting breast cancer. While it's true that making healthy diet and lifestyle changes does decrease your risk of developing breast cancer, there is nothing you can do to eliminate your risk completely. Even the healthiest of athletes have been diagnosed with breast cancer. Even women who undergo a bilateral mastectomy are at risk of developing breast cancer. Breast cancer is a complex disease with many variables and can affect anyone at any time. However, it's still of utmost importance to continuously be making healthy choices if you want to live a long and healthy life. And last but not least, myth number 10, sugar directly causes breast cancer. Although sugar hasn't been proven to directly cause breast cancer, there are a few known ways in which it can indirectly cause breast and other types of cancer. For example, eating too much sugar can result in obesity, which is a major risk factor for breast cancer. It can also result in diabetes, which increases your risks by up to 20%. If you've been following us for a while, you know where we stand on sugar. Basically, anyone and everyone should eat as little sugar as possible for disease prevention. I have another video on this channel where I discuss the top reasons for this. Sugar is addictive and causes cravings. The more you eat it, the more you crave it. It can weaken your immune system, cause mood swings. It leads to spikes in your insulin levels, which causes inflammation in your body. It breeds bad bacteria in your gut microbiome. It decreases your levels of good cholesterol. And it can increase the production of AGEs, which accelerates skin aging and wrinkle formation. No thanks. The problem is that it's not easy to cut back on sugar, especially when it's in most of the foods we eat. And it's one of the most addictive foods on the planet. But take it from someone who used to crave sugar after every meal. It is possible to cut sugar out of your diet, but you have to do it slowly. Once you stop eating it, your cravings will eventually subside. I promise. I've included a link below this video to learn more about our complete guide on how and why it's important for cancer survivors especially to cut back on your sugar intake and stop craving it for good. Inside the guide, I explain step by step on exactly how I cut back on sugar, and if I did it, so can you. Okay, so the key takeaways from this video are: anyone can get breast cancer regardless of their family history. All women over the age of 40 should speak with their doctor about getting a yearly mammogram. In addition to these, you should be doing self-breast exams monthly. I've included a link below on how to perform a self-breast exam properly. Other key takeaways are that not all breast lumps are cancerous, but if you do notice any changes in your breast, it's crucial that you speak with your doctor immediately. Also, you can reduce your risk of getting breast cancer or having it return by making healthy diet and lifestyle changes, especially exercising and reducing your sugar intake. Unfortunately, there are several other myths out there about breast or other types of cancer, especially around nutrition. For example, fasting doesn't cure cancer, neither does following the keto diet, and there is no single food or nutrient that will prevent or cure cancer. That's why it's important to rely on evidence-based information and consult with your healthcare team rather than listening to sleazy people online who are spreading inaccurate information. Remember that knowledge is power, and by understanding the true facts about cancer, you can make informed choices and increase your chances of becoming cancer-free or staying in remission. Don't forget to subscribe to this channel below for more valuable tips on navigating life with cancer.